Hello everyone, welcome at SudhirEyeCoach, a channel for budding and emerging ophthalmologists. Today I'll be sharing a video where I removed implantable columnar lens or ICL or a phakic IOL before performing cataract surgery. As we all know that ICL is often used to correct the myopia. However, over time some patients develop cataracts, leaving no choice but to proceed with cataract surgery. Removing the ICL is quite straightforward. It can be easily extracted through 2.2 millimeter of incision. You can see in the video how smoothly this process can be done. Once the ICL is removed, the cataract surgery follows the usual steps. However, since the patient is high myopic, extra precautions are necessary. Myopic eyes are more sensitive to pain, and sudden intraocular pressure changes can cause anterior chamber deepening, leading to discomfort to the patient. To prevent this, we must carefully control the machine settings and fluid dynamics during surgery. We perform surgery under low intraocular pressure settings to uh, provide the maximum comfort to the patient. So watch this video and see how the procedures unfolds. Hope you find it insightful. Enjoy the surgery, and if you have any query, comments, please uh, use this platform to share the knowledge. Thanks for watching.